Hello, sir. We are so grateful to have you on our channel. Um, can you please tell us your name?
Right. I'm Chire Thomas Kunsano.
Okay. And then we know that you play a major role at the Ankaful Psychiatric Hospital.
Yeah.
Please, what role do you play here?
Well, I'm the head of administration,
Okay.
and generally our work is what we call the support service
Okay.
in the health sector. You can do a broad classification of the services into, let's say, 3 or 4. You have
Okay.
what we call the clinical service, the doctors and generally what we call the prescribers.
Okay.
Then we have the other group, the nursing group. And then we also have what we call the allied health. That has to do with those generally in the diagnostic areas, the lab, the x-rays, and those areas. And then we have our group that we call the support service. We are not directly into clinical care, but we do all the other things that are necessary to facilitate the work of those who directly deal with the clients. So you are looking at issues of catering,
Okay.
stores and logistics, looking at transport, you are looking at estates, equipment, and all that. All the other things that you need to facilitate the work of those who deal directly with the client or do the ancillary things like the allied health people. So generally that is what we do as a support service.
Then your work is big because you have to
Quite
coordinate
big.
a whole lot of things.
Quite big.
Yeah. We because we are at the Ankaful Psychiatric Hospital, we want to be talking a lot about the hospital, see what you do here and other things. So can you please let us know what the hospital does? What is the primary goal of the hospital?
Oh, for us, our primary goal is to help people who have mental challenges to, as much as possible, try to reinstate them to their original state before the difficulty, and also to help those who have issues of addiction, because we are also into rehabilitation, drug and alcohol rehabilitation. So generally, that is what it is. The little bit is that we've added some general medical services, but that is just at the OPD level, and it's essentially to help us attend primarily to our mental health clients who may have other general conditions to help them out. But it's opened to both client, staff, and then the surrounding communities.
Okay, that's fine. I think that all over the country, people even know of the good job you're doing because when you mention Ankaful Psychiatric Hospital, people say a lot about the hospital.
Yeah.
So that's really good. But can you tell us a little about how the hospital started, the history of your facility?
Well, the little I know about it is that the construction started before 1965, but it actually started operating in 1965.
Wow.
As a purpose-built mental health hospital at the time. And it has been as such till now, just that the dynamics of its management have changed over time. Generally, at the time it started, everything was handled from the central level, managed by the ministry. Then in 1996, when Ghana Health Service came into being, it came under the umbrella of the Ghana Health Service and managed just like any other district hospital under the Ghana Health Service. Then around 2012, as a nation, we saw that mental health was something of importance to us, so we needed to give it some focus. So we came up with the Mental Health Act, which is the Act 846 of 2012, largely to give some attention, specific attention to mental health. So we did that, and as part of that process to ensure that we have specific focus for mental health, the agency of the Mental Health Authority was created as an agency under the Ministry of Health. And the intention was that once it's created as an authority in charge of mental health, then they will focus more on policy and the delivery of mental health care, so that we will not box it into general medical care where it fizzles out when it comes to resource allocation.
Yeah, that's fine. So we've seen that you've gone through a whole lot of changes.
Sure.
Yeah.
Sure.
And I believe probably this final change that you spoke about is really making a lot of effect, because now we see people talk a lot about mental health and its
Well,
effect.
in terms of exposure and placing the issue of mental health in the front burner, yes. But in terms of funding to run the system, I think it has rather given us a bit of a challenge.
Oh, okay.
Because the act that established the authority also came along with an aspect that required that we set up a levy that will be dedicated solely to mental health care. Unfortunately, since 2012, when the act was passed, till now, that levy has never come into fruition.
That's unfortunate.
And as a result of that, we are still largely being treated as any of the subvented institutions of government. And you know, subvented institutions is like you eat the crumbs that are left after the bigger shots have eaten.
Oh, okay. Well, we hope things get better for you.
We just pray.
Yeah. We see that the work you do is huge, because you have to be coordinating a whole lot of things.
Sure.
And I'm sure you probably have some administrative structures that will make your work a bit easy for you.
Sure.
Can you tell us how you operate so that things become a bit organized for you?
Well, in terms of managerial structures, like I said, we operate directly under the Mental Health Authority, which is an agency of the Ministry of Health. But at the institutional level, we have what we call the core management, which is effectively 7. But functionally, we are 8, because we have to get one of my colleagues to be secretary to the committee. So that is the bigger management body in the hospital, call it the umbrella managerial body. But below it, we have what we call the extended management, which is an embodiment of the entire management, and then all unit heads in the facility. Management, we meet at least once a month.
Okay.
Extended management is quarterly, and that is where we as managers take up the policy issues and discuss with the in-charges, and we also expect them to cascade it down to the staff that they work with. Then, aside that, we have other, should I call them, minor meetings. Well, the bigger, aside the extended management meeting, is what we call the staff deba, where we usually, it's also quarterly. Okay. We meet the staff and discuss broader issues that we think that they need to know, and also give support to.
Yeah, that's fine. You've been speaking about facilities. I'm sure you have a whole lot of facilities. I mean, even entering the hospital, I've seen so many things.
Yes.
Can you tell us some of the facilities you have that help you?
X-ray unit, a mobile one, very small one. Unfortunately, the components were not up, and it's still pending. The authority in December gave us some money to look for that component and buy. Unfortunately, it appears the price on the market is far in excess of how much we were given. So we now have to find the excess money to add up. So we don't have an X-ray unit now. Like I said, we have vehicles that we use for some of our activities. And mental health is a little broader than maybe we understand it. We have a wing we call the Community Psychiatric Unit. Mm-hmm. They are more into the health education, community mobilization, and all that. So transportation plays a key role in what we do. We also have a program that we call reintegration. When the clients have come and they've been treated and they need to get back home, sometimes we struggle to get the relatives to come for them. And they don't want to, some just out of the general difficulty we have in mental health and how we see it as a country, people just feel ashamed that this person is coming back to us. Maybe we've brought him to you. Even when he's well, we still think that he's not fit to come back home. So we'll have to do what we call reintegration. Yeah. And it just involves assigning staff to take the person back home, to sit with the family and talk with them to accept the person back home, that the person you brought to us, this is his state now, he's sound enough to come back home and then maybe engage in some meaningful life enterprises to help himself and the family at large. So because of that, it involves a lot of travel, sometimes as far as Kumasi and beyond, just to be able to reintegrate the person into the family. Yes.
Yeah. Oh, that's fine. So I've seen, I'm sure that from here we'll be seeing some of these, your facilities.
Sure.
We'll go around to check some of them that directly affect mental health.
Sure.
Now let's talk about your staff.
Yeah.
I'm sure the kind of patients that or the cases that you get here may be different cases,
Sure.
which require different attention.
Yeah.
So I'm sure you probably have. Can you tell us about your staff, the kind of staff you have, and how they're able to meet what you have to do?
Okay. So, like I said, almost all the broad areas that I mentioned, we have them here. The clinical staff, the doctors, the physician assistants. Then you come to the nursing field, we have them. The allied health, we have them. That is talking about the laboratory, talking about health information, the dietitians and all. We have them here. And then the support service. Broadly, that is what we have. But like I said, it is a hospital that was purpose-built for mental health. So the specialty is more of mental health. So the dominant staff here are the psychiatric nurses and then the specialists we have in that area, the psychiatrists. One of the critical staff that we ought to have is the clinical psychologist. Fortunately for us, we've just had an application from someone to come in. For some time now, we haven't had one at post.
Okay.
We're depending on part-timers and all that. And then, but the good thing is that we've taken a decision in the last 2 years to send our own staff to school.
Okay.
To go pursue the program and come back. I think at the moment we have 3 of them in school.
Okay.
One should be returning, I think, by close of this year.
All right.
We've sent 4 of our doctors to specialize in psychiatry. We are expecting 1 to by September this year, and they'll be coming back in succession. So we are hoping that in the next 2-3 years, we should have a large complement of the staff that we need to execute our mandate.
Wow. Then administration or management is doing a whole lot to improve your staff strength.
Yeah.
Please, I'm sure that as you are going on with your work and all these things, you probably face some challenges.
Sure.
Can you tell us some of the major ones that you face?
When it comes to challenges in mental health, they are just too many. But you look at the critical ones as we would want to, it's largely finance. You go out, you see the state of the infrastructure.
Yeah.
For some of them, since the inception of the hospital in 1965, nobody has come to touch any of them in terms of renovation or something. And it's all because over the years, the funding has been a problem. So we tend to focus more on the feeding and the little sanitation that we have to do. Yeah. You can see our road network and everything.
Terrible.
Horrible. We can't do much about that from what we get here. So when it comes to the challenges, the issue of finance is a critical thing. And maybe I'll take this opportunity to explain why funding is so key.
Okay.
You know, mental health is not like general health care where somebody comes to the hospital with malaria, maximum 3 days, 4 days, even with all the complications, they are gone home. You know, it's just like somebody, I use this example, handing over an unemployed adult to you to take care of.
Yeah.
Because once the relatives come and they go home, there's virtually no assistance in any form, like we have in the general hospitals where they will come virtually every evening to give food and all that. They hand over the person to you, feeding, clothing, sanitation, everything is on you as a facility. And the kinds of medications they take, they eat a lot. So if you lose guard on feeding, the agitations you will get, you wouldn't like them. So that is largely the bigger thing. And like I mentioned, we have a wing we call the community psychiatry that use a lot of vehicles in what they do. And the state of our transportation now is very poor. Almost all the vehicles are weak. It was last year we did some little rehabilitation on some of them, but still, they are still not that much fit for purpose. As we sit now, if you ask me in terms of transport, what we need a minivan, a strong minivan that will be able to do that community psychiatry work for us conveniently, and maybe a pickup or something to back that up. So largely, those are some of the things I call challenges. But one thing that hasn't got direct bearing on the clinical service we provide is the level of encroachment that we are suffering on the hospital's land. You know, it wasn't for nothing that those who built the hospital decided to locate it at the time in an area that was off town completely. You know, if you go out right now to one of our wards, we run what they call the forensic ward. And forensic simply means that you have criminal cases, hardened criminals who go to court and either pretending or in reality have some mental challenges. So they are referred here for an assessment. Yeah. So you go to a place like someone where you always see police officers fully armed and seated there. And because of that, you need a certain buffer between the hospital and whichever community that is closer. So that if such a criminal escapes and they have to open fire, no civilian life will be put in danger. But unfortunately, for whatever reason over the years, the issue of the land has never, cropped up on anybody, and they have encroached so much so that that buffer is missing. Okay, and right now, as we speak, you go around to the staff quarters area, where people have built just less than 30 feet away from our structures. Just yesterday, we had to make another report. They are now even coming into the service area. You were at the maternity side. Yeah. Right behind the maternity area there, people were there surveying to sell out the land just yesterday. So it's really a challenge for us, and staff don't really feel safe working here now because there are too many entry points into the hospital now, and the theft cases are increasing. So if you ask me of challenges, I would say finance. The personnel, like I said, we have them, all right, but the numbers that we require to fully function, we don't have the right complement of the staff, especially the psychiatrist, the clinical psychologist, the nurses. There's a bigger challenge that is coming up with the nurses now. A lot of them are running away. Because of COVID, I don't know for whatever reason, the advanced countries are seeking a lot of hands from underdeveloped countries. So we have a whole tsunami of our nurses. Some just abandon posts and then they are gone. As we speak, we have close to 60 applications going through us to the Ministry of Health for clearance. So that they can leave.
Wow.
So if they grant them now, and unfortunately those are the very senior ones who have been here for 8-10 years. They've gathered all the experience we need now to do what we are supposed to do, and they are the ones who are
the ones who want to leave.
Eager to leave.
It's not easy. I'm sure that from the challenges that you've mentioned, you definitely need support from society and individuals.
Sure. Maybe before we come in, there's one other challenge that usually it's a bit benign. Nobody talks about it really. But having been here for almost 3 years, I see it as a challenge that we need to deal with as a country. And it is an issue of stigma. All right? And that stigma, in my own estimation, is in 3 forms. One is a stigma on the person who is suffering the mental illness. General dejection from family, from friends, and all that, just because of the mental condition. 2 is the stigma on the family of the person. And that is why we tend to have this rejection even when they have been treated and they need to come for them. They'll reject them because they don't want the person to come closer, and then people will be pointing hands, oh, this is a family that has a mental health problem. Yeah. And then the last one, which is quite serious, but maybe nobody talks about it, is stigma for the staff who are even taking care of the clients. It may sound a bit weird.
That's what I'm trying to figure out.
Sure. Right now, all you need to do and know the real state of what I'm talking about is to get into town, let somebody offend you, and then you try to assert your rights, okay, by maybe getting into a little argument with a person. Once they get to know you are from mental hospital, so normally mental people, they'll describe it, they just think because you work in a mental hospital, you also have the condition. Yeah. And it's really a problem. It's really a problem. There's that stigma that we all suffer collectively just for working in a mental health facility. I mean, when I got my first appointment, whilst I was still at my old station, the very first day I disclosed it to a few friends. I remember one of the guys said, oh, he said it in our local language. He just shouted, said, hey, that madman's director.
Oh.
You know, even outside it. So it's really a problem. Stigma is a huge problem in mental health care. And as a country, we need to speak to it.
Yeah, very important. Yeah. And I'm sure that as people watch some of these videos, they probably would have to have a mindset change so that this issue of the stigma would be dealt with. I was saying earlier that I'm sure as you have challenges, you would want support from society, from individuals there who can help. Sure. So you already mentioned the thing that you need. So I'm hoping that people will also consider these things and come and help the hospital. Now let's ask you this. You have a goal as a hospital. Sure. You've come a long way. Yeah. Although you have challenges and all those things. Do you feel that at this point you are able to, or you are reaching some of your goals as a hospital, or you are serving your purpose as a hospital, as a psychiatric hospital? For sure.
Like I said, we're established for a purpose.
Yeah.
And if the hospital has been able to live from 1965 till now, and we've had staff all along, and the state has been paying them, and they haven't shut it down, it means that they are doing something good. It's a reason we exist. And our statistics will also tell you that clearly there's some progress that's being made in terms of getting people to get better and live here. Of course, as it is with medical care, you always have issues of relapse. People go home and they come back again and that kind of thing. But that is quite normal with particularly mental health care, especially if the persons involved are not ready to comply with the dictates of their medication and all that. You always have those relapses. But to a large extent, I would say that we are accomplishing the goal for which the hospital was established.
Yeah, that's fine. Yeah. Mr. Chire, is it?
Yes, please.
We are so grateful to you for the time you spent. You've really opened our eyes. We've seen a whole lot of things that goes on in the hospital. Right. We've seen that, yes, you have some challenges, but you are even working hard through these challenges. Sure. And you are getting lots of results. Yeah. We are grateful for the time you spent with us. We know you're a very busy man, but you were able to give us some time. And we know that from here, we'll move on into the hospital. We'll see a whole lot of other things about the hospital. Okay. Thanks a lot. And we'll meet you some other time.
Right. I'm grateful. But let me just add a little bit of one of the challenges that I think we should also pay attention to, particularly for the clinical staff that deal directly with the clients. There's a huge risk of personal harm to their persons. So here, the person has slapped me, is beating me, it's become a normal thing. In general healthcare, you don't have that. Mostly it's client relatives that will be threatening staff in general medical care. But here, the very person you are taking care of is the one who is attacking you. Yeah. So the risk level is quite high. And sometimes we have had staff being brutalized by clients when they are unable to control them. So for policymakers, we will suggest that we have to look at this risk aspect and look at it critically and do something about it.
Yeah. Right. I think this is true because even for family members of the patient, you can see that when someone has mental illness, even the family members are afraid to get closer to the person. Yeah. So sometimes it's as if they feel that when they come to the mental hospital, as for the staff, they have some kind of martial arts training that they can defend themselves for
certainly they are trained find a way of calming them and controlling them.
Yeah.
But there are some that before they even get the opportunity to control and calm them, they would have caused some harm.
Definitely.
Already. Those are the ones we are talking about. And sometimes it can get really very serious.
Yeah.
It can get really very serious.
Someone even told me of one case where a patient bit the hand of one nurse,
Yes.
like seriously, that the guy got so hurt.
Yeah.
Yeah.
We are following up on an issue right now with the Labour Office, where a gentleman was brutalized some years back. I think it happened just about a year before I came. And the matter has been pending. He's supposed to get some compensation. It's been calculated and forwarded to the ministries. Up until now, it hasn't come. And when it's like that, it's a bit demoralizing, and they are scared whether to put their lives forward in an attempt to help others. It's been, in fact, this February is my 3rd year since I came here, and the incident happened before I came.
A year before.
So you can imagine the frustration the gentleman is going through. I'm told, I mean, it was really serious. He went into coma. They had to go do brain scan and all that.
That's serious.
To help him out. So it's something we need to focus attention on.
Yeah, we feel for you. I mean, sitting back, when I see someone who is mentally ill, sometimes you get scared that when I get close to the person can harm me. And you are here with them, risking your life, or risking so many things. So we feel for you. And we are hoping that the authorities will put things in place so that you get some protection and even some compensation or some incentives for the risk that you are taking. Thanks a lot. We've enjoyed having a conversation with you.
Maybe just one.
No problem.
I would just want to say that as a country, we need to get a little more serious with mental health. You know, when we talk of mental health, our perception is that it is those who are naked and dirty walking on the streets who have the challenge. But if we sit with those specialists in the field and the kinds of persons we see here who come for services, nearly a large chunk of our population has that problem. Just that because they have been stripped, we tend to think that, people don't have challenges. And the issue of spiritualization of mental health, there's care for almost every mental health condition that our people suffer. But we will need to look at the issue of spiritualization. Sometimes people have mental health problems that can be dealt with easily. They end up at the prayer camps and the shrines and all that until it is worse, and they now bring them here. We need to look at that subject of the over-spiritualization. There is treatment for mental health conditions in the country. We need to pursue them and encourage our people to come for them so that we are not saying, some may just believe that the spiritual aspect is there. We are not discounting it, but we are saying that seek the human aspect first. When it fails, you can now fall back on the spiritual aspect for help.
All right. I'm sure that people watching the video will act on the thing that you are telling us.
Sure.
So that they will rather seek the help from professionals than to be sending their patients to places where they won't get any proper. But we've heard of stories where people get chained, go through a whole lot of stress, and then nothing comes out of it.
Sure.
But eventually, when they are brought to the mental hospital, they get
they get their freedom and go back home.
Yeah. So, that is why we have these facilities in our community. So we hope people will make the best decision and then get the proper help.
Okay.
All right. So thanks a lot. Thanks a lot. We've seen so many things. Although we spent just a few minutes with you, but we've seen so many things that the hospital does. We've seen the staff that you have. We've seen where you need help, where you are, the professionals you have.
Sure.
And I'm sure that in those areas where you need help, I'm hoping that within the shortest possible time, you will get the help that you need.
Yeah.
All right, thanks a lot. So now we'll head on into the hospital itself. We'll talk to some other people. We'll see your facilities, and then we'll see how best.
Okay.
Yeah.
All right. Thank you very much. But I'll urge that as you go around, you focus more on the structures because a lot of them are deteriorated. We need assistance to renovate some of the structures. They are really very bad.
Okay.
They're really very bad.
Okay.
Right.
We'll do that.
Thank you.
All right. So you have a nice day.
I wish you the same.
All right. Bye-bye.